they took 11 patients. They measured the bite of the patient before and after getting NUCCA care. And they did several before, several after, just to make sure they got, they did, to get more information, more data, less variables. And so what they found is that before and after, they saw a change in posture, and they also saw a change in bite occlusion. And I'm pretty sure the research shows that for the most part, posture improved with the patients in the frontal plane and in the transverse plane, but not in the anterior posterior, which is forward head carriage plane. So posture improved greatly, but then they also saw a lot of change happen in bite occlusion. Some improved and some did not. And so obviously the surprising thing is, why would it not improve? Why would improved posture change the bite for the worse? So let's address that question. What are your thoughts on that? Why would a corrective procedure that we know can help the body tremendously imbalance the bite afterward?
When you correct the abnormal spinal biomechanics, and this goes to this, or this goes to this, or this goes to
shoulders
this,
off to straight,
right?
neck off.
You got
to
all
straight,
kind of postural distortions down in the hips as well. One hip higher than the other balances out better. When you change that much structure, what happens is, and I've seen this in my practice, somebody with a tooth that's not sitting at the same height on one side as the other, if before the body had kind of balanced to that, so the structural misalignment in the spine is off one way because of that jaw problem. Okay, so we've created this created a misalignment in the spine, or it was they all kind of came together, but whatever, what have you. So you've got this problem in the jaw. You correct everything else. Now you got this problem in the teeth, right? How the teeth line up. I've seen this in my practice. If I can just say briefly, real quickly, we really want to avoid taking teeth out of the jaw. And there's a book called Jaws, like the Epic Pandemic or something like that. Look it up. But it's the history of teeth and jaws of humans in society today. And our teeth and our jaws have changed dramatically over the last 100 to 200 years for the worse. There's a lot of evolutionary things that are going on that are not great about, just the way our genes are coming together and smashing jaws back, creating smaller airways, all kinds. This is where the neuromuscular dentists come in. But what I'm saying is, okay, so you've got all these components and you're correcting the spinal biomechanics, but then you're leaving this problem in the jaw and you're not correcting it. So that's where a neuromuscular dentist would come in, because if this is off, I'm talking millimeters, man. It's the same thing in the neck. If the jaw's off by a millimeter or two, you're going to create all kinds of downstream issues from that.
And dentists have known that for decades with bites, right? Knowing not to change the bite because of the periodontal ligament reflexes and all that kind of stuff, right?
Yeah.
Yeah. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support.